I am super excited for today. I'm glad you guys are joining because we're about to have an hour packed of pharmacology fun. I think you guys are going to enjoy this session. I hope you learn a lot from it. And we're also giving away one free seat for the pharmacology crash course. So I don't know if you guys have heard about this event yet, but the pharmacology crash course is a 5-day high yield pharmacology review. It's 2 hours every day, September 16th through the 20th, Monday through Friday, 7 p.m. to 9 p.m. Central Time. It is awesome. It is my favorite thing that we have launched this year, other than nursing school that comes out officially next week. We've done a course per week so far in nursing school, but that fully launches next week. So this is my second favorite thing that we have launched. And today, each of you that is joining has the opportunity to potentially win a seat at this pharmacology crash course. It comes at a $50 value. Now, let's say you were like, man, I really need that pharm crash course, but I didn't win. Can I still sign up? Absolutely. You can still sign up even if you don't win. So to do that, you would just take your phone and scan that QR code, or you can just search Archer Review Pharm Crash Course, and it's going to take you to that link to sign up for the September Pharmacology Crash Course. Our instructor, Lauren, teaches it. She's amazing. She has so much knowledge when it comes to pharmacology. It amazes me every single time. I listen in every month and I learn something new from her every time she presents. It's really, really cool. So you want to start off strong, ready to go. It looks like some of you are already joining us for this Pharm Crash Course, but we're going to utilize Slido. This is how I'm going to pick my winner. We're going to have a leaderboard at the end of this. And so I want you guys to join me now on Slido, because this is how you could win that free seat, that free pharmacology crash course. Now, those that are joining on TikTok, will you guys let me know if my audio is okay? Just wanted to double check it, but I haven't seen any comments on it yet. So if you're joining on TikTok, let me know if my audio sounds all right. But let me know where you're joining. How you're going to join Slido is you are going to either open another browser and go to slido.com and type in #pharma, or you're going to take your mobile device, scan that QR code, or go to slido.com and type in pharma, just how you see it on my screen. When you type that in, it's going to join you into the event. Now, you're going to want to be quick, because as we go through these questions, whoever gets them correct the fastest is who will win that pharmacology seat at the end. So if you want to be that winner, you want to be ready, you want to have your phones handy, and you want to stay active and engaged throughout. Awesome. We've got individuals from New York, Canada, Tennessee, Dubai, Nepal, Indiana, Utah, Long Island, Sweden. That's cool. Manchester, Maryland. Awesome. California, Oklahoma, Georgia, Texas. I think it's always so cool. This is one of my favorite things to do, because we see people from all over, not just the United States, but all over the world. And I think it is the coolest thing ever that I get to sit here. I'm in South Dakota. I get to sit here in my office in South Dakota, that's in my house, and I get to hang out with you guys all across the country. How awesome is that? Technology, as much as it sometimes gives us fits, is really cool. And I'm excited that all of you are able to join. Now, if you haven't joined Slido yet, you're going to want to do it, because we're going to go for that winner, and that's going to start kind of right away. Now, by the way, if you are the winner, you have to be number one on that leaderboard. You will email us, NCLEX tutors at archerreview.com, or email me, Rachel@archerreview.com. So if you are the winner, hang around, because you need to make sure you've got that email so that you can email us if you are that number one spot on the leaderboard. Let's go ahead. Let's get started. We're going to start with everyone's favorite. We're going to start with pharmacology for the endocrine system. Now, why did I choose this? Endocrine is hard. Endocrine's challenging. I don't love endocrine medications. I know that. But you guys have to know them. So we're going to start with some of these more tricky ones, but I know that you guys can get them. So here is our first one. I'm going to read the description. As I read it, I want you to start thinking about what med, what hormone, what thing are we thinking about? And then as soon as I'm done reading it, I'm going to jump to the Slido slide, and that's when you're going to put in your answer. So have your phone or your Slido tab ready to go, because as soon as I read through this, I'm going to flip it to the Slido. This is a hormone created by our pancreas that controls the amount of glucose in our bloodstream at any given moment. It helps to store glucose in our liver, fat, and muscles. Without this hormone, we can't store glucose in our muscles or liver, and we can't make fat. Instead, without this hormone, the fat breaks down ketone bodies and causes our blood pH to drop to dangerous levels, leading to DKA. All right, are we ready? Be quick, be quick. What? Oh, you got to join the quiz first. Sorry, it's going to make you rejoin. After this one, you won't have to rejoin. I forgot about this step. Sorry, guys. I was making you be too quick, too ready. Okay, join me. Once I get to 150 people, I'm going to launch it. But let me get to 150. I might get to 200 because it looks like a lot of you are still joining. Again, to join on Slido, go to slido.com. Type in pharma. Type in pharma. That's how you're going to join this event. And these trophy ones are going to be, you'll see, it's got a trophy up here, says live quiz. These are the ones that count for our winner today. All right, we've got that 150. Let's get started. In 3, 2, 1. What hormone am I? Let's see how we do. What hormone am I? Be quick, be quick. You have to get it right, but also be the fastest. Let's see how we're doing. 5 seconds. All right. How do we do? Insulin. Nice. You guys got it. Mar H is in the lead in 3 seconds. Talia, second. Chanel, third. Abby is fourth. Whitney is fifth. You guys are all within a second of each other. You were correct if you said insulin. Insulin is responsible for making sure that we can utilize our carbs correctly, that we can get glucose inside of the cell. Because what insulin does is it is going to open up the cell. It's basically like the key to the cell so that insulin can then go inside. All right, we've got another one. This type of insulin is the only type that can be given via IV push or IV infusion. We would only give this type through an IV line. And Slido in 3, 2, 1. Get ready, get ready. What type of insulin am I? What type of insulin am I? So in the ICU, I took care of a lot of clients that had DKA. I swear, we always had someone in DKA almost every shift. And so when we had someone in DKA, they would go on an insulin drip. And the type of insulin always used for that insulin drip is regular insulin. Only 68% of you got this one correct. So if you missed this one, I would suggest that you write it down. This is a key point. I need you all to know it. Regular insulin is going to be the type that we will utilize, regular insulin, for somebody who needs it through an IV. Only kind you should ever be giving through an IV. Okay, Mar H is still in the lead. Chanel second. Whitney moved up to third. Rosemary fourth, and Rosemary fifth, all within the same second of each other. That's impressive. You said regular insulin, you got it right. All right, let's do another one. This is going to be kind of rapid fire. This medication works by lowering levels of glucose in the blood. This is a fast-acting insulin that starts to work about 15 minutes after injection, and it peaks in an hour. Those are the key points. It's fast-acting, works in 15 minutes, peaks at an hour. Okay, ready, set, go. What insulin am I? Can we get it? Now, if you're joining today and you're like, hey, this is kind of fun, let us know. Tag other future nurses. Feel free to share the live. It does stay on Facebook. So if you are joining on Facebook, on YouTube, it will stay there. So if you share it because you're like, oh, I want to watch this later, it'll be right there for you to watch. So feel free to share it. Tag other future nurses. Let's bring them into our farm fun. All right. How'd we do? How'd we do? Nice. 62% of you said Lispro. The key thing was that this was rapid acting. Now, the other big one that I want you to be able to recognize right off the bat is Glargy. What is that? Is that short acting, immediate acting, or long acting? It's long acting. That is a buzz one that you will see oftentimes on the NCLEX. Now, the other one that you might see often on the NCLEX is, you're right, it doesn't peak, Mona, good job, is NPH. Now, why do we say NPH a lot? Well, NPH is typically what we will mix with regular insulin. That's what they'll test you for. Now, I'm going to be honest. Real world nursing, I don't usually have to mix insulin. Why? Because we have insulin pens. But for NCLEX purposes, they may ask you about mixing. So NPH and regular, if I were to mix that, I would do clear then cloudy. I always remember the acronym RN, regular than NPH. That's how I'm drawing it up. But if it asked me, hey, how do I put air in? Well, I actually do it in the reverse order. I would put air into the NPH, then air into the regular. Then I would draw up the regular and then draw up the NPH. And the reason why is we don't want to get NPH accidentally mixed into the regular. Welcome, Harrison. I'm glad you're joining for the first time. I'm glad you are here. Lispro was the big answer there. And the reason why is paying attention to the peak time and the onset time. All right, this medication used to treat diabetes mellitus is categorized as an intermediate type of this medication, has an onset of 1 to 3 hours with a peak effect of 4 to 8. It's given subcutaneous. And questions on Zoom, you're going to want to put those questions in the Q&A. If you're just responding to me, just putting an answer in on Zoom, put it in the chat just like you're doing. But if you have an actual question for Jennifer, our chat support, put it in the Zoom Q&A. If you're joining on TikTok, we don't have, I don't think, anyone in chat support on TikTok. I'll try to answer any questions live if I see them come through. All right. All right, let's see. All right, ready? What insulin am I? What insulin am I? I lied. We do have chat support on TikTok. Let's see how we do here. All right, how'd we do? Nice. You guys got it. Ooh, let me go back. Sorry, NPH was correct. So NPH is an intermediate acting insulin. Why I hadn't talked about it yet was for this question exactly. But it's that intermediate acting insulin that we will mix right with that regular insulin. That's the big thing that they love to test on. All right, Whitney has taken the lead. Now, real quick, while I have you all here, let's take a moment. Let's talk about private tutoring. So let's say you're like, hey, I don't know if I'm ready to take the exam. I've been studying for weeks and I just don't know. Or maybe you're thinking, I don't know where to get started. I'm overwhelmed. I just failed the exam and I'm not sure where to go next, what to do next, how to be successful with the exam. I want you to consider private tutoring. It is $75 per hour. It's not free, but these tutors go through whatever you need for the full hour. It is based solely on you that entire time. It's just a one-to-one mentoring session with one of our highly trained tutors. A couple of us that aren't on there that do tutoring on request are like Jennifer, myself, we do it on request, but all of these other tutors should have openings readily available for you all to book. You just go to Archer Review Tutoring. Now, if you're someone who needs specifically pharma help, Lauren is the person for you. Lauren is who I would book. Lauren and Allie offer evening hours. So if you're like, Rachel, I work full time, there's no way I can do this Monday through Friday, 8 to 5. That's okay, because we offer hours that are going to be on the weekends. We offer hours that are in the mornings, in the afternoon, in the evenings. There is no private tutoring included in SurePass. It is a separate purchase. Now, if somebody said, hey, would you please repeat what I said about AIR with NPH? And remember, put your questions in Zoom in the Q&A. Just if you're responding to me, put it in the chat. But what I said was, for NPH and regular insulin, you actually inject air into NPH first, then into regular, then you draw up the regular, then you draw up the NPH. The reason why is we don't want to accidentally get some of that NPH in the regular vial. So that's why we're drawing up the regular into the syringe first. Again, study strategy, study skills, testing strategy, test anxiety. All of these things can be addressed with that private tutoring. All right, let's keep moving forward. This medication is a man-made form of the hormone insulin that works by lowering levels of glucose in the blood. The specific type of insulin is a long-acting form that starts to work several hours after injection, and it keeps working evenly for 24 hours. This medication can be used for type 1 or type 2 diabetes. All right, get ready, get ready. What insulin am I? And by the way, somebody asks, are we going to get tested on generic names or brand names? For NCLEX, you will always get the generic name. So I want you to answer with generic names only. So if you see a brand name, for NCLEX purposes, you're going to say automatically wrong, because the NCLEX is only going to look at the generic name. All right, how do we do? Nice, 85% of you got this one correct. Amazing work. Insulin glargine, great job. Now, should we ever mix long-acting insulins? What do we think? Are we ever mixing them? Are we ever mixing? No, we're never going to mix these long-acting insulins. So let's kind of review this just a little bit. So when we look at the different onset, peak, and duration time, this is kind of the general ones that I want you to know. You don't have to know everything. You don't have to know all of them, but I do want you to have a general idea. Now, somebody said, hey, is the peak for NPH 4 to 8 hours, or is it 4 to 12? I've actually seen both listed. It depends what resource you're using. I typically say on average, the 8 is kind of that central point. So I would say at least 8 hours, but I have seen resources say 4 to 8, some say 4 to 12. It really just depends what you're looking at. But let's go through these a little bit. What point would you want somebody to eat? When do you want someone to consume food? Okay. Anyone know? Do I want them to consume food at the onset, peak, duration? When are they at greatest risk for a hypoglycemic reaction? I need them to have a snack, and they might, right? Like if they're about to eat a meal, they might have some insulin right before their meal, 15, 30 minutes before their meal. Absolutely. But I need them to have a snack at the peak time. Why? Because let me get my little pen out here. If this is my insulin peaking, what is it going to look like with what my blood sugar is going to be? My blood sugar is going to be doing this, right? So if I don't give them any food at this peak, they are going to be in a trough with their blood glucose. We don't want a big change, a big drop in their blood glucose levels. Nice. Great job, everybody. Now, how do we store insulin? Because there's some specifics here when it comes to insulin storage. We do want to keep it away from heat and direct sunlight. So if it's like, hey, should we put insulin in the windowsill? No, absolutely not. It's not a good spot for us to put that insulin. Should we put it in the back of the fridge? No. Why? Because it could freeze in the back of the fridge. In the front of the fridge is totally fine. But if you've ever had something in the back of your fridge, I just had this happen to a bag of carrots. I took them out, I was going to eat them, and they were totally rock hard frozen in the back of my fridge. So because of that, there's a chance for it to freeze. And here's the problem. If it freezes, it's no good. And insulin is expensive. It costs a lot of money. And so we need to make sure that we are teaching our clients how to properly store the insulin. I don't want, because it froze, it to have to be thrown away. Now, once we open up that vial, right? Closed vials are stored in the fridge, but once we open that vial up, well, now we are just going to be able to utilize it and keep it at room temp. So I say keep it away from heat. So we don't want it. You know how there's cabinets right above people's ovens typically? Sometimes people will store it there. That's not a good spot. Why? Heat rises. So if I'm cooking, I'm boiling pasta, and that heat is rising, shoot, now my insulin might not be any good. So typically like in a drawer away from anything that would have major temperature extremes is a better place. Now, I have always just remembered at room temp 30 days. That's how I've always remembered it, but it does get a little more specific. So for nursing purposes, like on the floor, Glargine is 28, rapid and short acting are 28. Only NPH is actually that full month. Okay. It's actually at their full month. Now, why does that matter? We also can't give expired insulin. So we'll actually always mark it on the vial of open date, expiration date. But again, NCLEX purposes, when I was in your all shoes, I just remembered, if you just remember the 28 days or the 30 days, you'll probably get a question on that correct. So with insulin administration, how are we going to give it? Well, only regular is given through that IV. We already talked about that, but all others are given subcutaneously. And we have to make sure we rotate the sites. And why do we care about rotating sites? Well, if we don't, we get a problem. And what is that? Well, we can get what's called lipodystrophy, and it is where the tissue actually thickens. I've taken care of lots of clients that have this. They lived in their own home forever, so they always gave the insulin in the same spot. Well, what it does is it actually is going to make that tissue really thick. And the problem with it making the tissue really, really thick is now if I were to give insulin in that same spot, absorption is affected. And if absorption is affected, guess what? My insulin no longer is going to work correctly. Now, the only cloudy insulin that we have is NPH. And the reason why is it's a suspension. So if I have a NPH vial, I actually roll it. I don't shake it, I roll it. And that's just to mix up everything that's in that insulin vial. But that's the only one that should be cloudy. If you get out regular, if you get out, your Lispro and it's cloudy, it's bad. It's got to get tossed. Now, where are we going to give this insulin at? What are the different location sites that we might use? There's a lot of them. Really, you want to think of a fatty area. So like right under here in my arm, I've got, right, like if you look at this back part of my arm, there's kind of that fatty area. That's a good spot to give a sub-Q injection around the abdomen. But we do have to make sure that we are not too close to the umbilicus, right? We have to be an inch away from that umbilicus. We don't want to be right on top of it. We can also use that upper outer thigh, the buttock, and the back. Now, I'm going to be honest. When I'm working in the ICU, I'm rarely choosing the back and buttock. Is it an okay spot? Absolutely. But we also want to be at least, revealing of our client. So if I don't have to, do it in the buttock, I'm probably not going to. So insulin, I would choose one of those other sites in most cases. Now with small group tutoring, this is another option we have. I know some of you were probably thinking, I would so benefit from tutoring, but I can't afford that $75. If you can't, we offer something called small group tutoring. I love small group tutoring. It's probably my bread and butter. One of my favorite things I get to do. We have anywhere from 5 to 20 students. It just depends how many sign up. per session, and we cover things that where students typically need. For example, I offer a 2-hour NCLEX review, usually once a month. Kate offers pharmacology memory tricks. Lauren offers mock NCLEXs. Elizabeth does the areas of the NCLEX test plan. Shelly does study skills and test anxiety. And so really, there's a whole lot of options when it comes to small group tutoring. You can scan that QR code to check out what we have, but I'll also show you where to actually find that at the end of the session today. All right, let's get back to what we were doing. You guys were doing awesome in Slido. I want to make sure you get some more of these to see who our winners are at the end. So with this one, they're sweating, they're feeling fatigued, they're dizzy, they're hungry, they're shaky, their lips are a little tingly, they're a little confused, they're feeling those palpitations, they're irritated, they're anxious. I know me, if I don't feel good, I get a little irritated, not gonna lie. And these are symptoms of what? What are these a symptoms of? Let's open up Slido in 3, 2, 1. What do these tell me? They're shaky, they're irritable. What do we think's going on with our client? I'm going to tell you what, if I go too long without eating, my family jokes I get hangry. It's kind of the joke, right? You ever seen those Snickers commercials where they're a little hungry and they get a little grumpy? Kind of a similar thing here, right? So what do we think is going on with these individuals? Nice. Perfect. Nice. Whitney is still in the lead. I can't say that next name. I am really sorry. If you're joining in a chat, you can let me know how to pronounce it. I don't want to say it totally wrong. I'm going to say all these name wrongs. I'm really sorry. Nice job for those of you on the leaderboard. You all are doing awesome. I am sorry that I'm so awful at saying names. All right, here's our next one. This medication is indicated for the treatment of hyperthyroidism in patients with Graves' disease or toxic multinodular goiter, for whom thyroidectomy or radioactive iodine therapy are not appropriate treatment options. This medication is dosed once per day. Once per day. All right. Ready, set, go. What medication am I? Nice. You all are impressive. Look at you all go. I'm impressed. You got 8 seconds. Quick on it. Be quick. There's about 50 of you that still need to answer. Go, go, go. All right. So what do we have? Ooh, okay. Methimazole. How do I know that? I'm going to go back for just a minute and show this to you guys. They have Graves' disease. Graves' disease is what? Hyperthyroidism. We do not give levothyroxine to somebody who has Graves' disease. Why? What is levothyroxine? It is synthetic T4. When somebody has hyperthyroidism, they don't need more T3 and they don't need more T4. We give methimazole. And what methimazole is going to do is it's going to basically decrease the amount of thyroid hormone that that client is able to create. Now, there are some risks with it, just like any medication, but the big one to watch for is, hey, did we over suppress that thyroid gland and are we now not making enough? It can also cause those platelet levels to decrease. All right, this medication is used to treat diabetes insipidus, which is caused by a lack of a naturally occurring pituitary hormone in the body. It can be given at home via nasal spray. This medication may also be used in emergency settings to raise blood pressure in adults who are in shock. All right, let's see how we do with this one. I'll show the leaderboard again after this question. 3, 2, 1. What medication am I? The last one was methimazole. All right, let's see how we did here. Nice, vasopressin. Whitney still in the lead. Simone has joined us in second. Kavita third. Jiwan, I'm sorry if I'm saying that wrong. So sorry if I'm saying it wrong. Fourth, and FK is fifth. All right, we've got 4 more to go. But let's go ahead. Let's talk a little bit about vasopressin because I do want you guys to understand this medication. So when we think about vasopressin, what it's actually going to do is it's going to lead to more water being retained in the body. Instead of it being peed out, we're retaining it. Well, what does that do for the body? It's going to increase the amount of volume. And when we increase that volume, when we increase that water reabsorption, what's that going to do for our blood pressure? It's going to bring that blood pressure up. So when I have clients who are maybe in shock, they can't retain enough, water, they're hypotensive, I give vasopressin. And what we're doing is we're increasing the volume because when we increase that blood pressure, we can improve MAP. And when we improve MAP, what is that going to do for our clients? It's going to improve the amount of circulation they're getting. Well, why do I care about that? Getting blood to tissues is what gets the oxygen there. Our body cannot go long without oxygen. And so we have to make sure that our clients are getting enough oxygenation. Now, the big thing, if I'm all of a sudden retaining a whole bunch of fluid, what do I expect my sodium to do? It might kind of dilute out that sodium. And so we have to watch it closely. We have to be really careful that we don't cause our sodium to get too low. Because then if we do that, we've got a whole slew of new problems. We've got neurological issues. We've got other things going on. So we want to monitor that sodium. We do want to watch urine output. If we stop having urine output, we also have a problem, right? We need to make sure our kidneys are still working okay. And there is a chance for anaphylaxis, so we do want to look for that. All right. One more thing I really want to talk about, there actually might be a couple, is the SurePass program. So if any of you are new today, several of you said, this is the first time I've done anything with Archer Review. If that's you, this is the package I would purchase if you are prepping for the NCLEX. If you're still in nursing school, this is not the package for you. But if you are graduated, you're starting your NCLEX prep, I want you to look at the SurePass program. SurePass is going to include our QBank for the RN. It has just shy of 3,000 questions. We have over 100 hours of on-demand videos, a 3-day live review, which that's really my bread and butter. That's my baby, the 3-day live review. I run our 3-day live review with a whole bunch of support from my amazing, amazing team that I work with. And we cover all of the high yield NCLEX topics in 24 hours. It's amazing. It's hard work, but it is so much fun. We also have daily live lectures in this. Monday, Wednesday, Fridays are live case studies, and Tuesday, Thursdays are 3-hour live content lectures. Now, somebody said, hey, when should I get the SurePass program? I always encourage the 90-day package. We have a 60-day package, but it's only like $10 more, I think, or 20 to get the 90-day. So I would do it 90 days out, purchase the 90-day, and I would attend the 3-day live review like 2 weeks before your exam is my favorite suggestion, is to book the 3-day live review 2 weeks before your test toward the end of your prep. And here's why. You're going to do better with that 3-day live review if you've already done some initial prep, and it's going to tell you, do I know what I need to know to pass my exam? I see students that join at the end of their prep are way ahead. They do so much better than ones that join at the beginning. Now, I'm not saying you can't join at the beginning. You totally can, but I actually recommend joining it at the end. We do have study calendars in your Archer Review dashboard under study calendars. 6-week plan is for first-time test takers. 12-week plan is for repeat test takers. Awesome. It looks like some of you just got the 90-day package. I'm not sure what that one question is in TikTok. You might need to rephrase. Someone said, hey, my NCLEX is in 30 days. What do you recommend studying? So somebody asked, what about the 3-week plan? I like it if you're a repeat test taker. it's a little hard to just do it in 3 weeks if you haven't prepped yet. My mindset, and I'm getting way off topic, but I have to do it now that somebody asked. My mindset is if you're going to do it, if you're going to take this test, do it the right way. Make sure you put your full effort in and that you are ready to go in there and pass. Now, I'm not saying that some of you might not have some setbacks. I'm not saying some of you, might not fail and then feel like, oh man, I thought I did everything. It happens, right? You don't have to have the standard of perfection. I want you to go in there confident though. If you have self-doubt, if you're like, I only gave 20% effort, then you can only expect 20% results. But give your full effort now. So that way, when you go to that test, you can get full results. That's my mindset. That's my motto with it. But yes, you could do the 3-week plan and then the 3-day live review. It wouldn't be my best recommendation, but it would be okay. Okay. I can show you, Erica, how to find a tutor, and I bet Jennifer could post the link for us in the chat in Zoom. All right. Oh, sorry, I did not mean to show that. Let's go back. This medication, and I am sorry that I can't say this word right now, biguanide, used in clients with type 2 diabetes. This medication works in 3 ways. It's going to make the body more sensitive to insulin. It decreases the absorption of insulin. Or sorry, yeah, did I say that? The absorption of sugar, through the intestines, and it lowers sugar production by the liver. All right, take a few moments, think about this. What medication am I? 3, 2, 1. So you won't be able to join us in Zoom for this session, but I can show you guys how to sign up for all the future ones that are coming up. We have webinars every Monday, Wednesday, Friday, except for live review weeks. If you're a week or 2 out, you feel like you're in crunch time for your NCLEX, book a private tutor session. It'll probably be one of the best things. Students give rave reviews on our private tutors, rave reviews of how much it helped them find NCLEX success. So if you feel unsure and in that boat, that would be my recommendation. Nice. Metformin, Whitney's still in the lead. Simone, you're just 4 seconds behind. All right, let's see who's going to keep being quick. So our biguanides, which I feel like I'm not saying perfectly, like metformin, what they're actually going to do is it just makes our body a little more effective, right? It makes our insulin a little more effective. It reduces blood sugar levels. It kind of like ditches some of that glucose for us is how I think of it. Now, how does it enhance insulin sensitivity? Well, this is why I can only give metformin to type 2 diabetics, not type 1 diabetics. Why is that? Well, type 1 diabetics, their factory is broken. They cannot make any insulin at all. Type 2 diabetics, okay, their factory is still there. It's just making the wrong products. Like, let's say that the factory makes keys. These keys are bent, they're crooked, they don't open any doors. But then when we give metformin, it makes some of those keys effective. That's how I think of metformin. I don't know if that helped, if that analogy helped. Okay. Now, the big thing with metformin is we do hold for 48 hours before a procedure. And the reason why is it's tough on the kidneys and we can end up going into lactic acidosis. It also comes with a lot of GI issues. So we want to monitor that kidney, hydrate them really well, after any type of procedure. And then we do want to make sure that we have them avoid any alcohol. All right, here is the next one. This medication is a synthetic thyroid hormone. It's used to treat hypothyroidism, a condition where the thyroid gland does not produce enough thyroid hormone. The thyroid hormone is crucial for regulating various metabolic processes in the body, including energy production and utilization, body temperature regulation, and normal functioning of the heart, muscles, and other organs. All right. Are we ready? Are we ready? You guys should know this one. I expect a 90% here. What medication am I? We already talked about this a little bit, so I think you can get it. I think you guys are going to get it. Nice. I love that thought, Tori. That is awesome. So Tori on TikTok said, levothyroxine leaves the hormone in the body. I kind of like that. Kind of helps increase, right? That T3, T4. Why? I should say T4. Levothyroxine is man-made T4. That's what levothyroxine is. So it's going to get that thyroid hormone up. Whitney still in the lead. Simone, 4 seconds. You're just 4 seconds off. This is going to be a race. It's going to be a little tight to the finish. Kavita, you too, only 4 seconds off. You were quick on that one. G1 is about 7 seconds away, as well as Jazz. And again, if I say your name wrong, please tell me, and I apologize if I do. All right, so our thyroid replacement, the big thing with levothyroxine, when do we take it? On an empty stomach. And because it has to be taken on an empty stomach, same time, every day, most people take it first thing in the morning. Because typically people don't have an empty stomach end of day. So first thing in the morning, we also want to tell them, don't stop taking it abruptly and watch for signs of hyperthyroidism. If I'm giving somebody T4, if I'm giving them synthetic thyroid hormone, there is a risk that they get too much. And now we've got the opposite issue. So we do want to watch for indicators that the body is speeding up. And those should be reported to the provider. All right, this is an oral medication classified as a sulfonylurea. It's commonly used to treat type 2 diabetes. It works by stimulating the beta cells in the pancreas to produce more insulin, which helps lower blood glucose levels. This medication helps increase the body's sensitivity to insulin, allowing it to be more effectively regulate blood sugar. I'm going to give you just another second or two for this one, just because I feel like this one's a little harder. So look through it. Typically, it's if they can't manage their blood glucose levels through diet and exercise alone. All right. Ready, set, go. Let's see who's going to be the quickest. Can you guys make up those 4 seconds that you're behind? If any of you are joining our 3-day live review next week, we also give away 3 Farm Crash Course seats in the 3-day live review. So if you don't win today, there might be a chance to win there. All right, let's see. How do we do? Nice. Glipizide is correct. Whitney, 3 seconds ahead of Simone. You guys are so close, neck and neck there. So let's talk about this just a little bit. Again, what glipizide is really going to do is it's going to promote insulin release and improve insulin sensitivity. It makes that insulin more effective. Now, the other thing that I really want you guys to understand is there are side effects that come with this. So we do want to make sure that we are educating on those. We want them to take this right with or right before their meal and to watch for signs of hypoglycemia. So if they know they're not going to eat, they shouldn't take it, right? It's going to be right before they're about to sit down for a meal because of that hypoglycemic risk. And here's just a little list of these anti-diabetic agents. For sake of time, I'm not going to go super into depth on them, but they are a little different. So how I would learn these and how I like to do it is I really like to just look at the class. And as long as I know the class and the most likely meds that fall in that class, it makes it a little bit easier. So when we look at our insulin sensitizers, what we notice is those are going to end in glitazone. So if you remember that ending, you're going to know those are our insulin sensitizers, but they come with this risk of an increased risk of heart failure. And so we don't always use them. If our client already has risk for heart failure, this is not going to be a med that we would want to start with and give our clients. The other thing is there is a risk for edema. So we do want them to really macular edema. We want them to really report any vision changes that could come with that one. We did already talk about those sulfonylureas and the biguanides. All right. We've got one more practice question. This is going to be for the winner. So this is where we need to be the fastest. We need to be ready to go. Here's the information. This medication is a synthetic corticosteroid. It belongs to a class of drugs called glucocorticoids. It is used for a wide range of medical conditions due to its potent anti-inflammatory and immunosuppressive properties. It mimics the effects of cortisol, a hormone produced by the adrenal glands, and can influence a variety of processes in the body. 3, 2, 1. Who's going to get it? Let's see. I'm excited to see who our winner is. Now, after this question, I want you guys to let us know in the chats, like in TikTok, in Zoom, in Facebook, YouTube, what you think of this style of free webinar. Did we have fun today? Did we like it? I have tons of things I want to show you all before you head out, but I do want to see what your thoughts were on this style. If you felt like it kept you more engaged, if you thought it was fun, or if you're like, Rachel, this was awful. Pitch it and try something different. All right. Nice. Prednisone. And our winner is Simone. Plot twist at the end. Simone got it. Amazing. I did not see that coming. So Simone, screenshot your phone right now with that, like that you're a number one. I want you to email me directly, rachel@archerreview.com. If you email me and it should show like you were the winner. Email that to me, rachel@archerreview.com, and I will go ahead and get you added to that pharmacology crash course in September. Amazing. Amazing. Now somebody said, hey, are you doing this again? Every Monday, Wednesday, Friday, we are doing a different free webinar. This is the only one that's styled like this right now, but that doesn't mean that we can't add more. I had a ton of fun, so eventually we might have some more that are this type of format. But we do want these to be helpful to you and offered so it brings more knowledge to you and you guys enjoy it. I'm losing my words at this moment anyway. So if you guys have suggestions, if you're like, hey, I think this would be a great thing to do a webinar on, you can always reach out via email. You can email us NCLEXtutors@archerreview.com. Whatever one, you want to reach out to is totally fine, but let us know your thoughts. What we love doing is making your thoughts become something so that every student can benefit. Our goal is to help each and every one of you succeed and reach your goals as a nurse. All right, the answer was prednisone. I need to talk about prednisone just a little bit. With prednisone, some of the big things I want you to know. One, our clients can end up with hyperglycemia. We want to watch for that. And the reason why is it makes it where the body kind of, when we have steroids, right, it makes it where the body can't utilize insulin as well. And so we have to be really, really careful that they don't end up hyperglycemic. Even in a non-diabetic, we're going to be kind of watching for that. It also leads to weight gain. There's a lot of side effects. They're at higher risk for, getting infection. It causes issues with the immune system. So there's lots and lots that go on here. Now, again, if you weren't the winner today and you're like, I really want to do that Pharm crash course, let me show you exactly where you can find it. So, and then lots of you are like, hey, how do I sign up for this? How do I sign up for that? I'm going to show you. I'm going to show you all of it. So don't worry. Let me give you a little tour here. So what you should do is you're just going to go to Archer Review. Click on Archer Review. Make that. Oops. Whatever. It's not quite my full screen. I don't know why it isn't going down. Whatever. That's okay. You're going to go to nursing. Now you're going to see something new has been added under nursing is nursing school. And I do want to take a minute to show you guys that, but I'm going to show you the Pharm crash course first. I'm going to show you the NCLEX stuff first. I'm going to show you nursing school at the end. Now, even if you're like, I already finished nursing school, I don't need that. I want you to listen because we have a ton of free stuff right now. And that free stuff could still help you, right, end up being successful on your NCLEX. And it was only free. The Pharm crash course was only free to that number one, the person in the number one seat, not everybody on the leaderboard. So what we're going to do is let's take a look real quick at how to find that Pharm crash course. So click NCLEX RN or PN, whichever one is you. Go to our features and find Pharmacology crash course. This is how you sign up for the crash course. It's going to be right here. It's going to show you what you need, and you can register for it here. It's going to show all of our upcoming dates for September, October, and November. Now, the next thing I want to show you guys is the SurePass package. You're going to go to Archer Review. You're going to go to Nursing, NCLEX, RN, or PN, whichever one is you. Click SurePass, and then what you're going to do is scroll down. You have to scroll a ways. Here's the available options. So it's $159 for 60 days. For 30 extra days, it's literally 10 bucks different. I would just do the 90-day. That's always my recommendation. Somebody did ask, hey, is there an earlier date for the Pharm Crash Course? Unfortunately, no, that mid-September date is the next one that we have available. All right. Now, the other thing that I wanted to go ahead and show you was tutoring, and then we'll move over to the free nursing school stuff that you guys are going to want to check out. So here, when you're in Archer Review Nursing, to find tutoring, you're just going to move over to private tutors and click NCLEX. Once you're here, you can see all of our tutors. Allie has a session tonight. Megan has test taking strategies. This is an awesome small group. Highly recommend this small group here. And then Lauren has 2 private tutor sessions tonight. Several of you said, Rachel, I'm about to test, and I'm a little nervous about that. Book with Lauren. Absolutely, I would book with Lauren. If you need pharma help, Lauren is the person for you. All right. And then tomorrow, Kate has priority in EKGs. This priority session is a must, in my opinion, before you take your NCLEX. Now, something that's pretty cool is, let's say you want priority EKGs, and then Lauren has a one-on-one. You're like, yeah, I could use all that. When you book 3 or more sessions, you get a 10% discount. When you book 5 sessions, you get a 15% discount. And when you book 10 sessions, you get a 20% discount. We're trying to make this affordable, okay? All right. Now, the only other thing that I wanted to show you guys was nursing school. So again, go to Archer Review Nursing, courses, click nursing school. And this is pretty cool. So tune me back in if you tune me out. If you're sick of me talking, tune me back in. So when you're here, what you can do is you can get any of these launched courses for absolutely free. So what you would do is you're going to scroll down to these nursing school courses. And let me tell you, these were created by nurses for nurses. Now, this isn't a replacement for nursing school. It is a companion. It goes along with your nursing school. The only person who created these that isn't a nurse is our math instructor, Brandon. Let me tell you, if you struggle with dose calc, this is what you want to get, okay? So what I want you to do is I want you to add growth and development, health assessment, dosage calc, lab values. You guys see here how that $15 is crossed out and it says free? Go ahead and get these. These are totally free to you right now. They're not going to be free forever, but we want your all's feedback on them. So we've launched them all at no cost. Now, this is for nursing school, but even if you're NCLEX, you can add this. So total price is free. You're going to check out. These are going to be active for 90 days. And it tells me, hey, you already purchased them. That's because I've already added them to my dashboard. So I'm going to go ahead then and head on over to my dashboard because I've just purchased them, right? Then what I need to do is I'm going to go ahead. I'm going to click this arrow. Now, if you don't have a package with us yet, it'll ask you to make an account. And then you're going to go to unactivated courses. And you're going to go ahead and click on activate. I'm not going to activate it just because I want to show this another time, but click activate. Once you do so, you're going to see it under your courses. So yesterday I activated health assessment and growth and development. And this is where you can answer your specific questions, and there's on-demand videos. With these on-demand videos, if you click on the paperclip, you are going to see, sorry, it's going to start playing. You are going to see that there's going to be notes that are attached. So after topics, you're going to go to notes. You're going to see here that there's different cheat sheets. So this one has a skin assessment cheat sheet. There's going to be different options listed for you as well as all the slides. So this is awesome. Simone, absolutely, you got the right email. Perfect. Anyway, so that is what we have right now for nursing school. Huge announcement, but a week from yesterday, So Tuesday next week, after the holiday, we'll be releasing all of our nursing school courses. This has taken over a year of love. Our nursing school lead, Annie, has poured her heart and soul into this. A lot of our team members that you see here today, Jennifer and Elizabeth, worked on maternity. I did ABGs and Nursing School 101. Those of you that know me know I love testing strategies, know I love to talk about test anxiety, and that's what I do with that Nursing School 101. So I'm super excited for you guys to all get your hands on it. And again, even if you are done with nursing school, you're prepping for the NCLEX, there's a benefit in a lot of those courses for you. Love to hear your feedback. Thank you guys so much for joining today. We are glad that you're here, and we just want you all to know that we're more than just test prep. I'm not just here for you guys to buy our package and say, see you later. I'm here to help you find success. Whether you are going through nursing school, whether you are graduated and you're trying to take your NCLEX, whether you graduated 25 years ago and you're on your 17th attempt and you're like, man, I don't know what to do, but maybe Archer Review is the answer. That is what we are here for. We are here to help you find that success that you maybe haven't been able to find before. So please go ahead and join us. I'm glad that you enjoyed the lecture today. I had so much fun. Sign up for nursing school. It's totally free right now. It doesn't cost you a certain, like anything at all. You should just be able to purchase those free courses like I showed you. We do a free webinar, not on test taking strategies specifically, but we have some mock NCLEXs that we do. I think we have one on study skills. Lauren Korth is the one who I would recommend for pharm. If you need pharm help, book Lauren. She's so smart. Oh my goodness. She's in her, I think her doctorate program right now. Literally so smart at pharm. I, on the other hand, I can teach you pharm, but she's way better than I am, I promise. You can find this webinar again on our Facebook. So if you go to our Facebook, you will be able to see it listed right there. Congrats, Sarah. Sarah just joined us on TikTok just to let us know that they've passed the NCLEX with Archer. Kudos to you. That is amazing. Thanks for letting us know. We love when you all hop on to let us know that you've been successful. Bye, everyone. Thanks for being a part of the Archer Review family. I wish you all the best of luck. Bye, guys.